You wake up, and before you've even glanced at the clock, your tongue is glued to the roof of your mouth, not a single drop of moisture left to swallow, parched like old paper. Maybe by now you keep a cup of water on your nightstand, just so you're able to speak once morning arrives. And somewhere along the way, someone told you this is just a normal part of growing older. Take a sip, don't think twice about it. And yes, water does help, for a little while, but that relief fades before you've even made it to the kitchen. And the reason it fades so fast is exactly what I want to walk you through today. I'm Dr. Narita, an internal medicine physician with 15 years behind me in this field, and I'll put it to you as directly as I can. That dryness in your mouth is a signal. Every single morning, your body is trying to communicate something to you. For most people past the age of 60, it's telling you one of two things. Either something you're swallowing daily has silently shut down your saliva production, or there's an underlying condition that hasn't been diagnosed yet, quietly revealing itself through a fluid almost nobody pays attention to. Saliva does so much more than simply keep your mouth moist. While you're asleep, it's performing 4 distinct functions that keep you protected. And the moment your mouth dries out, all 4 of those functions grind to a halt simultaneously. Each failure opens up a different pathway of risk. One leads toward your lungs, one affects how well your food genuinely nourishes you, one runs directly into your bloodstream and heart, and one you'll notice first in your teeth. Before you scroll past this thinking dry mouth couldn't possibly matter, stay with me. A major study published in Scientific Reports back in 2021 found that older adults dealing with dry mouth carried a measurably elevated risk of death in the years that followed compared to those without it. Now, a study of that kind can't prove dry mouth is the direct cause, but it's detecting something genuine. Dry mouth tends to show up alongside everything I'm about to walk you through, quietly piling up in the background while people continue to dismiss it as nothing important. By the time we finish here, you'll know how to interpret your own dry mouth the same way I do, what each variation is signaling, which medication in your cabinet is the most likely culprit, the precise language to use with your physician so they finally take it seriously, and what actually restores your saliva, because it's almost never just another glass of water. There's also a 2-minute test you can perform tomorrow morning before your feet even touch the floor that has revealed more about a patient's genuine risk level than nearly anything else in my practice. I'll share it with you, but it only makes sense once you grasp those 4 functions. So let's begin there. And honestly, this is the core of everything I do these days. After all these years in practice, what matters most to me is helping people remain strong and self-sufficient well into their 70s, 80s, and beyond, rather than gradually handing their health over to something they never saw approaching. So I gathered everything I share with my own patients and compiled it into a single, straightforward plan. What to eat, the daily habits that genuinely protect you, the warning signs you should never brush aside, all of it consolidated in one resource. It's already made a real difference for thousands of people living their best years after 60. If you want it, the link is right there on your screen. No need to jot anything down or memorize a thing. It's ready whenever you are. Now, let me introduce you to someone because she crosses my mind every time this topic comes up. I'll refer to her as Eleanor. She represents a composite of patients I've treated through the years, but everything that happened to her is grounded in reality. And I've watched this scenario unfold more times than I'd like to admit. Eleanor was 69, a retired school librarian, exactly the type of person who reads every label carefully and never wants to be a burden to anyone. For roughly 2 years, she'd wake each morning with her mouth completely parched. She'd keep a glass of water beside her bed, take a sip, and carry on with her day. She brought it up once, in passing, during a routine checkup. She was told it was probably just aging, maybe try drinking a bit more water. So that's precisely what she did for 2 full years. And the entire time, quietly, her body was working its way through the exact list I'm about to lay out for you. Nobody had ever explained the fundamental truth to Eleanor, the truth I want to make certain you never have to learn through hard experience. Saliva matters far more than most people realize. Scientists have cataloged over 1,000 distinct proteins within it, a combination of enzymes and natural infection fighters working inside your mouth every minute, day and night. It's one of the most underappreciated fluids your body produces, and it carries out 4 essential functions. Let me walk through them individually, because each one, when it stops working, brings its own particular danger. And the first is precisely why I felt compelled to create this video in the first place. The first function of saliva is defending your airway while you're asleep. Something takes place every single night that most people are completely unaware of. A tiny amount of the fluid in your mouth trickles down the back of your throat and into your airway during sleep. This is called microaspiration, and it's entirely normal. A study published way back in 1978 in the American Journal of Medicine discovered that approximately 45% of otherwise healthy adults experience this exact process during deep sleep. Nearly half of the population. And for someone in good health, it causes zero harm whatsoever. I'll explain precisely why. In a properly functioning mouth, saliva works continuously to suppress bacterial growth. It's packed with natural defensive compounds, things called immunoglobulin A, lysozyme, and lactoferrin. Their entire job is to keep the bacteria living in your mouth at a manageable level. So that small droplet of fluid you inhale overnight is essentially clean. Your lungs process it without issue, and you never even register that it happened. Now take that same mouth and let it dry out. Strip away the saliva night after night, and those defensive compounds disappear right along with it. The bacteria that were previously kept in check are now free to multiply unchecked. So that little bit of fluid slipping into your lungs at 3 a.m. is no longer nearly clean, it's heavily contaminated. You're quietly inhaling an increasingly concentrated dose of bacteria into your lungs every night while you sleep peacefully, completely unaware. In an older adult whose cough reflex and lung clearing ability have already slowed down compared to their younger years, this becomes one of the pathways through which a serious respiratory infection takes root. Poor oral health combined with a heavy bacterial load in the mouth is a well-documented risk factor for pneumonia among older individuals. That's simply the mechanics of how it works. This was Eleanor's first open door. Looking back, she'd experienced 2 separate chest infections over an 18-month span. Each time, a doctor prescribed antibiotics and sent her home. Each time, nobody thought to ask the obvious question, why does this keep happening to her? Nobody linked a wet cough in winter to a dry mouth every morning, but they're part of the same underlying story. So what should you actually do about this one? You protect your mouth throughout the night, and I'll give you the complete routine before we wrap up. But the essence of it is simple. You avoid going to bed with a completely dry mouth whenever you can. A touch of humidity in the bedroom, the correct kind of rinse before sleeping, and maintaining good, gentle oral hygiene to keep bacterial levels down, all of this reduces the dose you're breathing in. Hold on to that idea, because it carries more weight than almost anything else on this list. The second function of saliva is helping you actually absorb nourishment from your food, and this is the one that catches people completely off guard. We tend to think digestion begins somewhere in the stomach, but it actually starts in your mouth the instant you begin chewing. Saliva contains an enzyme called amylase, and amylase starts breaking down the starches in your food before you've even swallowed. Saliva is also what allows you to taste your meal, what softens it and molds it into something you can swallow with ease, what makes eating the simple pleasure it's meant to be. Remove the saliva and eating quickly stops being enjoyable. Dry food becomes scratchy going down, swallowing requires real effort, food tastes flatter, and people react to this without ever consciously choosing to. They start eating less. They begin steering clear of drier foods, meats, whole grains, raw vegetables, precisely the foods carrying the most nutritional value, and they drift towards soft, effortless, processed alternatives that slide down without resistance. Those alternatives tend to be the least nutritious, so the plate still looks mostly finished, but the body underneath is being fed less and less of what it genuinely requires. I want to state this next part very clearly because it catches nearly every patient off guard when I explain it. You can eat 3 full meals a day and still be gradually starved of proper nutrition. And the data backs this up. A 2023 review published in the journal Nutrients found that older adults dealing with dry mouth were roughly 11% more likely to experience significant unintended weight loss. Other studies have shown that people with dry mouth consume measurably less water, less folate, less vitamin E, and fewer of the healthy fats their heart and brain rely on. A large 2025 review discovered that the majority of older adults with dry mouth were either malnourished or teetering right on that edge. This is happening to an enormous number of people, and almost none of them realize dry mouth is the underlying cause. Eleanor lost weight, a pound here, a couple pounds there, until her daughter noticed her clothes hanging loosely and asked what was going on. Eleanor didn't have an answer for her. She'd been eating. She thought everything was fine. That was her second door, standing wide open, and nobody had even walked past it to check. The remedy here begins before you alter a single thing about your diet. When food becomes dry and difficult to manage, you moisten it. You lean on the saliva substitutes I'll describe shortly, particularly before meals. And you protect your appetite by keeping your mouth comfortable. You fight to keep nutritious foods on your plate, softened if needed, rather than swapping them out for the empty, effortless options. The third function of saliva is maintaining balance among the bacteria residing in your mouth. And when that balance collapses, the damage doesn't stay contained to your mouth. Your mouth hosts an estimated 700 distinct species of bacteria. This is entirely typical for everyone, and the vast majority are harmless. Saliva is what keeps them balanced, continuously suppressing the harmful ones so the overall ecosystem stays stable. Once the saliva dries up, that regulation disappears, and the species responsible for real damage, the ones behind gum disease and tooth decay with tongue-twisting names like Streptococcus mutans and Porphyromonas gingivalis, are precisely the ones that surge in number. Research examining older adults with dry mouth has documented this shift directly, and its consequences extend well beyond your mouth. Your gums contain countless tiny blood vessels. When they become inflamed and bleeding, which happens as these bacteria take control, something as routine as brushing or chewing can push bacteria straight out of your mouth and into your bloodstream. Once they're circulating in your blood, they travel. This is well-established medicine, not fringe theory. Oral bacteria in the bloodstream can settle on a heart valve and trigger a dangerous infection known as endocarditis, which is exactly why your dentist inquires about your heart health before certain procedures. There's a two-way relationship between gum disease and diabetes, each one making the other harder to manage, confirmed by a large review published in Scientific Reports in 2021. And there's newer, genuinely remarkable research published in Science Advances in 2019 that identified one of these gum disease bacteria present in the brains of people who had died with Alzheimer's disease. I want to be careful and transparent with you here, because that last finding represents early-stage science and doesn't establish cause and effect. But it's one more reason why what's living in your mouth shouldn't be dismissed as we age. Eleanor never reached this third door, thankfully. Part of the reason is that someone eventually paused and examined the complete picture. But I've treated patients who did walk through it, and it's difficult to witness because every step of the way was preventable. Let me pause here briefly, and then we'll continue. If this is the kind of straightforward, honest explanation you wish you had more time to receive in the exam room, do me a small favor and hit subscribe. And give this video a like while you're at it. It genuinely helps this information reach more people before they need it urgently. And leave a comment. Tell me how long you've been waking up with dry mouth, because I read everyone and it shapes what I cover going forward. All right, the fourth function of saliva is protecting your teeth, and this one progresses faster than almost anyone anticipates. Around the clock, saliva bathes your teeth in minerals and neutralizes the acids that wear enamel away. It's a constant, gentle repair mechanism. Take it away, and that repair process shuts down entirely. This is why dry mouth can trigger a wave of aggressive tooth decay, even in someone who's brushed diligently their entire life, and even in someone wearing dentures, which I'll circle back to because it surprises a lot of people. Dentists sometimes watch a mouth deteriorate over the span of just a few months and know, before asking a single question, that they're dealing with dry mouth. The teeth are often where this entire problem first becomes visible, and by that point, the other three doors have typically been open for quite a while. The protective steps here are fairly simple, and I'll fold them into the overall plan. Keep your mouth moist, use the appropriate rinse, rely on fluoride, and don't skip your dental checkups, because your dentist might catch this before your physician does. So those are the four functions, and the four doors that swing open once saliva fails. Which brings us to the question that genuinely changes everything. Why did your saliva stop working in the first place? Because that's the part you actually have control over. And for the overwhelming majority of people over 60, the answer is sitting in a cabinet somewhere in the kitchen or bathroom. It's your medications. This is, by a wide margin, the single most common cause of dry mouth. According to the Cleveland Clinic, more than 500 different medications list dry mouth as a potential side effect. 500. And these aren't obscure, rarely prescribed drugs. They're among the most commonly used medications in the country. Blood pressure medications, antidepressants, allergy antihistamines, diuretics, bladder control drugs, and sleep aids. If you're over 60, there's a strong likelihood you're taking at least one of these, and plenty of people are taking several simultaneously. These medications share a property almost nobody ever explains. Their effects compound, and they compound faster than you'd expect. A particular category of them, a class physicians refer to as anticholinergics, are especially effective at shutting off saliva production. Two of them combined can dry you out more than double what either would do alone. A 2024 study found that older adults taking these types of medications were significantly more likely to have genuinely reduced saliva flow compared to those taking none. And the more of them someone was prescribed, the worse the effect became. Physicians have a term for this cumulative effect. They call it your combined anticholinergic burden. I want you to remember that exact phrase because you're going to use it. There's also a meaningful threshold to be aware of. Once someone is taking 5 or more medications of any kind, something referred to as polypharmacy, the risk of side effects like this climbs sharply, and it becomes genuinely difficult for any single physician to track how they're all interacting with one another. This turned out to be Eleanor's actual answer. When someone finally sat down and reviewed her complete medication list, she'd been taking several drugs for years, 3 of which were individually mild in effect. Combined together, they'd been drying out her mouth for 2 solid years, and not a single person had ever examined the combination. But medications aren't the only trigger for dry mouth. And this is where you get to play detective, because the specific character of your dry mouth often reveals which other door needs checking. So let me hand you the guide for reading your own symptoms. If your dry mouth is most severe first thing in the morning and improves as the day progresses, that points toward mouth breathing during sleep, and frequently toward sleep apnea, where your airway repeatedly collapses while you're sleeping. In one study, approximately 45% of people with sleep apnea woke up with dry mouth, compared to roughly 20% of people without the condition. If that description matches you, especially paired with snoring or daytime fatigue, ask your doctor about a sleep study. If it's paired with getting up repeatedly through the night to urinate, that combination is one of the classic early warning signs of elevated blood sugar. Excess sugar draws water out of your tissues, which dries your mouth while simultaneously filling your bladder. Ask your physician for a simple blood sugar test, the one called an A1C. Pair dry mouth with dry, gritty eyes, that sandy sensation, and you're looking at the signature of an autoimmune condition called Sjogren's syndrome, where the immune system attacks the very glands responsible for producing your tears and saliva. It's considerably more common in women. Roughly 9 out of 10 people affected by it are women, and it typically emerges during your 50s and 60s. It's highly treatable, but it has to be identified first. A metallic taste or breath that begins to carry a faint ammonia smell is a more serious combination and can indicate the kidneys are struggling to properly clear waste from the body. Don't panic about it, but do get your kidney function tested. And dry mouth accompanied by leg or foot cramps can suggest your electrolytes are out of balance, the sodium, potassium, and magnesium your body depends on. That particular combination matters significantly because a severe enough imbalance can affect your heart rhythm, and it's more likely if you're taking diuretics. Get your levels checked. Do you see what's happening here? Your dry mouth is providing you with information. It's one of the very few warning signals your body gives you that you can actually decode yourself at home for free before a single test is ever ordered. Now, let me address 3 things I know some of you are thinking because I hear these constantly in my office. First, some of you are thinking, my doctor told me it's just aging. With all due respect to your doctor, that's almost never the genuine explanation. Truel.